Namaste and hello. I am Sakshee Singh and you are watching Vibes of India. Can we really force someone to bring a new life in the world? So, as one country is already striking for a basic human right, let's talk about the abortion laws in India. So, we have three gynecologists with us who will share their opinion about the abortion laws in India and more information about it. So, to discuss on this special topic, we have a special guest with us, Dr. Aarti, Dr. Cecil, and Dr. Chaitasi, who will tell us that what are the abortion laws in India. I want to ask you, does people don't have this basic human right that they can decide that whether they can get a new life in their life or not?
uh, Abortion laws in India have been made since 1971, which is around the time abortion laws in all other countries had started.
Yes.
And we have been very fortunate that the abortion law, instead of being repealed like some other countries,
Yes.
we are being strengthened, and we have been gifted with a stronger MTP Act, which is the abortion law in India.
Yes. So, it's legal in India, abortion.
Yes, definitely. As Dr. Cecil said, I would like to emphasize the same thing that way back in 1971, when the MTP Act came and we stopped criminalizing abortion, which was the fact before 1971, only 15 countries in the world at that time had done it. And India had a very progressive law, and as we see, even the United States went on to pro-abortion laws at the same time, but now it is going to a very regressive dark space with the overturning of the Roe versus Wade. Yes. And in India, yes, definitely abortion or MTP, medical termination of pregnancy, is still legal.
So, what is an abortion? Can you please tell people what is abortion actually?
So, it is upon a female whether she wants to bear a child or not. It is completely a prerogative of a woman to decide upon that. Abortion is termination of pregnancy. It can be natural or it can be induced. When a person does not want pregnancy, that is what we call medical termination of pregnancy.
So, who can get abortion? Like, who would really go opt for abortion?
So, initially, when it was in 1971, the implement came into picture. That time, it was specific to only married women.
Yes.
Who could terminate pregnancy till 20 weeks of pregnancy. But now, in 2021, a new amendment has come into place, which does not only depend on marital status of a female, unmarried female or living with a partner as well is okay to undergo medical termination of pregnancy if the pregnancy is less than 24 weeks.
So, do you support, like, according to India culture and everything, do you support this point that an unmarried girl can also abort child?
Certainly, why not? It is a right to every female.
And what do you
So
think?
I think when we are equating culture with this, we are taking this in an entirely different connotation, because the debate is pro-abortion or anti-abortion, and I feel the debate is actually about pro-choice.
Yes.
Once a woman already has a life in her womb, it is entirely her body and her prerogative. What is the point of having a child in the world who is not wanted and is probably not going to be housed, fed, educated, or taken care of well? So the point is not just procreation, the point is bringing voluntarily and happily a new life into the world. As far as the Indian culture is concerned, I think we need to, bring out this topic from under the carpets and have it in our living rooms and talk about it, because yes, fortunately, unfortunately, consensually or under some other circumstance, a girl has fallen pregnant and she is not married. She definitely has the right to choose whether she wishes to continue with the pregnancy and decide how to go about it.
So, is there any certain age in like for this thing you can get abortion? Is it
So, as per the legal laws, yes, any woman above the age of 18 does not require the consent of any other living person to go ahead with a medical termination of pregnancy. But for minors, yes, that
We need the consent of the parent or the guardian. It's
Or
not
the
even
legal
necessary that the parents need to sign. For a minor, even a guardian can give consent. And anyone above 18. In India, the law says that we only need the consent of the woman. She doesn't need the consent of anyone to undergo abortion.
that's how it should be,
That's
because
how
it's a
exactly it
basic
should
human
be.
right which they should
Yes.
sports should not come in between
Yes.
this decision of a mother and
Mother.
whether she wants
Which
that
is
child.
why I said, as Indian women and doctors and citizens, we are in a place of pride because we are one of the few countries. Japan, a supposedly progressive country like Japan, is still struggling with legalizing even the medical pill.
Yes.
The USA, as I said, is going ahead into a dark tunnel of space, while we as Indians still have a lot to be proud of because our laws are very women friendly and
In
abortion
fact,
friendly.
we had the laws that we could abort the pregnancy till only 20 weeks, and after representation from gynecologists and lot of doctors, that we could not even diagnose certain anomalies before 20
and
weeks.
patients.
And patients
Petitions,
might
yes.
not even, yes, patients had petitioned that we want the right to abortion because my child is not normal, and it is beyond 20 weeks. After due deliberation, they have come up with the law that we can do medical termination of pregnancy till 24 weeks.
Yes.
And this law also, allows women who are divorced, whose marital status has changed during the course of pregnancy, divorced or widowed, or they are in some disaster condition, or the woman is mentally or physically not all right, or the child is abnormal, or it is the pregnancy is a result of rape or incest. All of these women can opt for medical termination of pregnancy till 24 weeks. In fact, the new law also states that if there is a fetal anomaly, there is no limit of gestation. You can ask for termination, but you have to apply to a board. And that board consists of a sonologist, a gynecologist, a pediatrician, and a government official.
So like, can we do abortion anywhere or or it's compulsory to have it under doctor's guidance only?
No, there are rules like where you can have medical
Yes,
termination.
medical practitioners are specific who can terminate, especially gynecologists. We are the ones who would actually help in termination.
Yes.
And the government also states that there are people who are trained for a very long term in gynecology. They can also do it.
What can happen to the people who don't come to gynec and maybe?
So there we are discussing a very grey zone and a very critical topic called unsafe
Unsafe
abortions,
abortion.
where
Yes.
even today more than, the reported statistics say 10 women die.
Because
of
I have
but I'm
seen
sure the
girls
figure
doing
is
it.
much larger. So yes, there needs to be awareness, there needs to be sensitization, there needs to be confidentiality and a wider access to specialized health care. Because that is where unsafe abortions happen, where quack practice happens, where people self-medicate or take OTC prescriptions, or a chemist sells them some drugs and then they land up with unfortunate
So maybe
complications.
because they are doing it by themselves because of some personal
Fear.
reason.
It's not that they are not accessible. It's because of the taboo attached to it.
Yes.
The stigma.
The
Yes.
stigma. That is
So
why.
what can we do
That is
to?
precisely why it is a grey area.
Yes, yes.
So what can we do or tell to those people who don't do it under the guidance of you gynecologists? Like it's how you can tell them that it's totally unsafe.
So, firstly, like as doctors or as a society, instead of preaching them what not to do or preaching them that this is not the correct thing to do or not culturally acceptable, try to be open about it and see how you can help them through this.
Yes.
Give them the confidence that this process that they are going through will be a confidential thing, because according to the new law, the gynecologist is not supposed to divulge any information
Identity.
about the MTP to anyone except the lawmaker. If there is some issue and the law demands that we should divulge the information, only then we can. So we have to give them confidence.
I think
Yes.
the girls or the people watching this need to know some key things. One, it is going to be confidential. Their identity cannot be revealed under the law. Second, it can be done only with their consent. So it is not necessary that they have to drag into this any other member that they do not want. And the third thing is this common public perception के chemist से दवाई लेके ये हो जाएगा. Then this awareness needs to be told to them that there are things like ectopic pregnancy.
pregnancy.
A gynecologist needs to check that the pregnancy is inside the uterus, the womb, not somewhere else. Needs to decide pills देनी है or the lady needs some other form of abortion process. And even if it is something as simple as popping a pill, which is the common perception, that these pills are available anywhere. So why do we need to actually go to a gynecologist?
So can chemists give those
No.
medicines
Only
without
as per the
prescription?
prescription of a
Of the
doctor, and not by themselves.
But by and large we see, legally it is not allowed.
But it is being sold.
Yes, it is
Without
sold, and we
prescription,
see
right?
complications day in and out. after girls taking
Catastrophic
these pills, catastrophic like
what they go through
like
when they take pill like without
As
prescription.
I said, no, rarely the pregnancy may be outside the uterus, which is called ectopic pregnancy. There
the
is
tubes.
fallopian tubes which are just adjacent next to the uterus. And if the pregnancy is there and you take abortion pills, they will not work. And at some point,
it might rupture.
the tube
And it
bursts,
could be a life-threatening
and the lady
complication.
might die.
Again, the lady has taken the pill without showing it to a doctor. So if she is a little beyond certain weeks, then the pill will not work and it can cause
Life-threatening
heavy bleeding and
And the pregnancy might stay.
it might stay. It might
And grow.
continue despite of bleeding.
You guys have got such patience.
Day in
Many,
and day
many,
out.
day in and day
The
out.
craze is day in and
Absolutely.
day out. And we also see women who feel, there is also common, कि pills, we took pills, we had bleeding, it's
So
done.
we are done.
And then you see that there is something called our terminology is RPOC, retained products of conception, or as Dr. Chaitasi said, the pregnancy is actually there, the heartbeat is there, the baby is growing. Or there were twins, one is growing.
One is growing,
Or-
or the retained product, they can get infected and cause severe sepsis, or future
Infertility.
pregnancy, it will hinder the future
And
pregnancy.
if the pregnancy stays after that, like the baby is safe or
See,
We do not
we
advise
do
that.
we do not advise it because but
pills-
we cannot be sure. There are a lot of studies required, but it is said that these pills can be teratogenic, especially lung issues or Mobius syndrome.
So these pills might cause birth defects to the unborn child. So once a patient has taken even a single dose of MTP pills and somehow failed to abort, we advise termination by one way or the other and not continuation.
so like what is the period till what time they can abort their child? Kabhi bhi?
In India,
With pills, it is 49 days from the last day of the period. The pill,
7 weeks.
7 weeks.
So even this point needs education, I think, because
Yes.
the people count pregnancy in terms of months.
Months.
1.5 mahina hua, 2 mahina hua, while the gynecology and the scientific term is weeks. So the first day of the last missed period is considered as day 0, and from there, if we calculate in weeks, as Dr. Cecil rightly said, up till 7
49
weeks,
days from the
49
last
days,
day.
we
That's
recommend
how,
pills.
Okay.
Earlier the better.
Earlier the better.
So is there any other way other than like this pill or something
See,
how
pills
you
is
abort
number
it?
one. We start with the pills
pill.
if the pregnancy is less than 7 weeks.
Okay.
Then if the pregnancy is more than 7 weeks, then we do something which is called a suctioning and evacuation. Surgical procedures. That takes place after that.
And there also needs to be an awareness that when we call the method a surgical method, there is no cut or
Yeah.
incision involved. It is just suctioning out with a disposable plastic
Taking out the
cannula
products
with
under
a suction
anesthesia,
machine
yeah.
under anesthesia, which is not painful. It requires only a few hours of admission,
And it's safe.
and it is as safe as
As
any
safe as it
procedure
can
can
be in
be.
the hands of a trained
Trained
expert
and at a
gynecologist.
proper place.
At a proper place. And then the third way, I think even the surgical thing, the suction she mentioned, is only up till
Up till
12 weeks.
12 weeks.
After 12 weeks, meaning after 3 months to 5 months, we have to actually induce a kind of
Mini labor.
where we give medication to the patient so the patient expels the fetus or the baby.
Yes, and that has to be done in expert hands, but people kind of, since they are way late into the pregnancy, they still go to quacks and try to induce labor, and that can lead to catastrophic complications.
Because that leads to excess bleeding.
What is the difference between these pills and contraceptive pills?
These pills are specific for termination of pregnancy. Contraception is something which will not
Prevent
allow
a pregnancy.
Before you get pregnant, the steps that you take.
And
So
what
the-
you are talking about is the emergency contraceptive pill. We see these ads, na?
the eye pill.
The eye pill. Okay,
Yes.
you didn't have protected sex, just pop an eye pill.
So is
They are
it-
also extremely misleading. Like eye pill is to be taken after an unprotected intercourse, but that has a very high dose of hormones. So when we use the word emergency contraceptive, we must remember the word emergency. It's not to be taken as a normal contraceptive.
And it is not 100% effective.
And that is not
You
necessary.
cannot bank on that.
Yes,
We
yes.
That I
see
have taken
pregnancies even with
With emergency
And it also
contraceptive.
leads to menstrual irregularities.
Because it's a
and
very
other-
high dose hormone.
It is absolutely different from the abortion pills.
And
The
it's
composition
absolutely
is
different
the
from the
chemicals.
normal contraceptive pill.
So people still need to get educated about this.
Yes.
The word emergency cannot, it's not something that you
Something-
take 5 times a year.
Yeah.
Then it is not an emergency pill.
Yes.
Pill. It's like after a rape or after like breaking of a condom.
Yes.
In all such instances where it is an emergency and you don't have any other option, that is when you take the emergency contraceptive pill. Don't pop it as a contraceptive pill the way it is shown in these advertisements.
And having said so, there are people who tell us that I had taken an I pill, how can I get pregnant? You can get pregnant because it is not 100% sure shot of not conceiving.
Even the
No
methods of
contraception.
contraception are not 100%.
None of the methods of contraception are 100%.
Then why they are being like,
Because they are better than nothing. They all have their percentages, and the contraceptive pill, the usual contraceptive pill, is almost 98% effective, which is a very
Yes, but there is this big myth in India that if you take contraceptive pills, you will have infertility later.
people prefer
So
emergency
people prefer
contraceptive pills.
emergency
On a
contraceptive,
regular
which is
basis.
10 times more stronger than a normal contraceptive pill, and that can lead to a lot of hormonal disturbances.
She's right. There are a lot of myths about birth control in India. The acceptance, even to something, I will call it copperty in common parlance, but IUCD. So when you say that everything in the body that happens is attributed to
IUCD.
copperty. But so yes, there is very low acceptance to population control methods, which also leads to
And I'm not talking about these myths in layman or uneducated
Educated
women.
urban
Absolutely
areas.
educated women who
so
had
India
access to
have
Google.
made such good rules for like women's, or as you said, but still why people are not that much aware of it? What we can do to make them aware of it?
I think it starts right at home. The discussions, it starts right from sex education.
Correct.
As I said, the topic needs to come out from under the carpet to the living rooms where mothers, parents are more open with their children. Children have access to good sex education. They don't end up making mistakes because they don't know whom to turn to, whom to ask. And then once a pregnancy is in place, the person needs to know that there is good quality healthcare available, where you are in safe hands, where you will not be judged, and where you would be able to do what you want to do safely.
Family people are like the safest to whom
Yes,
we
they are
can
the one who
share,
will
but
bring them to
India
us.
doesn't
Yes.
allow us to share the
Share.
things with
I
our
think
they
mom.
take
every girl
advices
has to
of-
have a safety
Yes.
circle.
Yes,
which
and
is-
who can be
it could
better
be a
than their
friend.
mom?
Their
It
mom.
could be a
Yes,
friend.
yes.
It could be a mother. It could be a neighbor. It could be someone who has to be in a position of trust and who tells that person, come what may, you
And
have.
the healthcare provider has to be non-judgmental. They don't want moral
Yes.
policing.
Yes.
That why did you get pregnant and,
and
you should not
not
have gotten
supposed to do
pregnant.
that
We are
in
not.
either
That's
ways.
not our job. We have to help her in the best possible
Understand
way that we
her
can
choices.
under the circumstances that she has fallen into.
So this need to be start from self home, like.
And the stigma of
The stigma.
people will come to know. So that is
There is a
very
stigma of an
important point.
unmarried girl waiting in the reception area of a gynecologist.
Or even somebody who doesn't look like a married
Like a
couple.
mother. Yes. Yes.
Even if you are with a
Your
male partner,
yes.
and you do not look like a conventional married
married
couple. So
couple.
all
They
those
are also
things,
that's what society makes them conscious.
So what all things still you think that India need to amend and like so that they can make it more proper to.
I think as far as abortion laws go, we are near perfect.
We are near perfect. Yes, yes. There isn't much that we can change, but bringing about the awareness by programs such as this and the media.
Also restricting
and
the
national-
access to these pills over the counter.
Yes,
that
they,
needs to be.
that is the first thing that they
there
need
needs
to
to
do.
be a really.
There has to be
clamping down
really
on-
strong.
क्योंकि अगर मिलेगा नहीं तो कोई लेगा
कौन
नहीं.
लेगा?
So then,
आप अमेरिका या कहीं भी जाओ, आप पैरासिटामोल से ज्यादा कुछ नहीं ले सकते.
with a lot of
हम
difficulty.
खुद नहीं ले सकते when we travel.
Nobody
can. So how can you buy an empty pill off the counter?
Actually, legally it is not allowed. They give it. So
They
that
give.
should be
that
stopped.
should be very very strictly stopped.
Thank you so much for giving such good advices. I hope that girls out there who will listen to this conversation, they will have more knowledge now and they will take proper actions. Thank you for your time and discussing on this topic, abortion laws in India.
Thank you, Sakshee, for taking up this topic
Yes, we
and
appreciate
thinking that it is
your
very
sensitivity
important.
towards
Yes,
this
sensitivity
topic because
towards
it
this.
is much needed.
Much
Yes.
needed, and I think many discussions as this also can bring about a lot of awareness.
Change.
Awareness. Thank you so much for giving us your time.
Thank you.
Thank
Yes.
you.